According to the American Diabetes Association, type 1 diabetes affects nearly 400,000 Americans under the age of 20. But now new research is showing the benefits of taking vitamin D to help children and young people navigate type 1 diabetes. Joining us now to discuss is Dr. Benjamin Wosu, Chief of Endocrinology and Director of the Diabetes Center at Cohen Children's and researcher with the Feinstein Institute. And we have Katia St. Croix, a parent whose child has type 1 diabetes. Welcome to the both of you. Good to see you.
Thank
Hello,
you.
how are
Good
you?
morning.
And Doctor, can you talk about the key points of this research and how vitamin D helps?
Sure. So there are two key points from our research. One is that vitamin D helps to prolong the partial clinical remission phase or the honeymoon phase of type 1 diabetes. The second key point is that research showed the mechanism of this impact. It actually decreases what's called the pro-insulin to C-peptide ratio, meaning it helps the body to form good and functional insulin after the diagnosis of type 1 diabetes.
And Katia, talk about the benefits you started seeing after your daughter started taking vitamin D.
I found that the parameters that Dr. Nosu wanted to keep her within, she was staying within those parameters. So she was diagnosed with diabetic ketoacidosis, and her sugars were really high. And then we were able to get it within the parameter, and it's been able to stay within that parameter since she's been taking the vitamin D.
And
so
Doctor,
it's been very beneficial.
Well, that's great to hear. Doctor, can you explain this honeymoon phase that you're talking about in the type 1 diabetes and why it's crucial for treatment?
Sure. The honeymoon phase is a period following the diagnosis of type 1 diabetes and introduction of insulin therapy. That is when the surviving beta cells are able to recover some of their functions and in some cases begin to make their own insulin, even though we're still giving insulin injections to the patients. So the longer the honeymoon period, the better for the patients, because honeymoon period also reduces the risk of long-term complications of type 1 diabetes.
And Katia, I wanted to ask you, what's been the most challenging part about your family's journey navigating type 1 diabetes?
Watching this so that she doesn't like insulin sense, and we have good care.
Doctor, how does using vitamin D as a supplement help patients, not only physically, but also financially, we understand?
Absolutely. So physically, vitamin D has two major functions, what I will classify as the hard function and the soft functions. So the hard function is just to maintain our skeleton and our bone health. But the soft functions are actually to decrease inflammation in the entire body and also to modulate or to fine-tune the immune system and also to protect some of these cells in the body, such as the beta cells of the pancreas that make insulin. Now let's move to finance. This is the cheapest and safest agent to prolong the honeymoon phase of type 1 diabetes. In addition, this vitamin D makes it possible for any human being around the world to access this research and its findings and use it without actually having to spend a lot of money or have to negotiate with insurance companies for access to this therapy.
And are you recommending it for all of your patients?
Yes, actually we have a follow-up study, which is like a real-world study where parents can now opt in to give their children vitamin D after they're diagnosed with type 1 diabetes, going on at the Cohen Children's Medical Center right now.
Well, Dr. Benjamin Wosu, Chief of Endocrinology and Director of the Diabetes Center at Cohen Children's, is a researcher as well, and Katia St. Croix, a parent whose child has type 1 diabetes. We thank you very much for talking with us today. Appreciate it.
Thank you.
Thank you.